Hi, I'm Dr. Leo Treyzon, and today I'd like to talk to you about the different treatments for chronic constipation. And this is something I'm really excited about. It's something I do on a daily basis. And I wanted to share my thoughts and my reflections after spending 14 years helping people with this problem. I am a gastroenterologist. I have a private practice in Los Angeles, and my specialty is helping people with unexplained abdominal pain, altered bowel habit, gas, bloating, acid reflux, and constipation is one of the really common things that we specialize in. And this video is just my thoughts on the subject, and I hope that it's helpful for you. I want to first start off by saying I think it'll take about 20 to 30 minutes to go over all of these things. The video has a specific focus on the treatments for constipation, and I think we're going to review somewhere between 25 and 28 different ideas for how to treat constipation that have worked for other people that I have seen. I want to start off by saying I'm also going to describe these products or concepts in the bottom of this video in typed out format, so don't scramble to try to write everything down and just enjoy the subject. So first, why don't we start off by defining what constipation is. It's basically an unpleasant or non-satisfactory experience with defecation or pooping. And it's really common. Maybe 1 in every 10 people that you see on the street has this problem. And it is defined in a more rigorous manner by one of the following criteria. Infrequent bowel movements, which we consider to be fewer than 3 bowel movements per week. Difficulty in evacuating the stool, meaning like you go often, but when you do want to go, you can't get it out either fully or even at all. Perhaps like a sense of a blockage or a barrier for its exit. And then a third feature is a discomfort associated with going, whether it is pain in the anterior abdomen or sometimes pain in the lower rectum area. That's important too. And we have to sort of discriminate this condition of chronic idiopathic constipation versus irritable bowel syndrome constipation predominant. And in the latter one, there tends to be more anterior abdominal pain. In many ways, the conditions are similarly treated, and some of the concepts that I'll be going over for chronic constipation also apply to irritable bowel syndrome, constipation predominant. I also hope in the future to have other videos of relevance, one of which will be about irritable bowel syndrome, about bloating and bacterial overgrowth type phenomenon, and then upper digestive problems such as acid reflux, dyspepsia, burping, indigestion. So stay tuned for those kind of videos in the future. And please leave any comments if you have any specific things that you think would be interesting. So why don't we also start off by talking about how do bowels move? How do you get a bowel movement in the first place? In general, from the time we eat food to the time it reaches our colon, it takes about 6 hours on average, okay? And then it takes about another 36 hours to go from the very top of the colon to the exit of the colon. And that is about 12 hours in the right colon, 12 hours in the middle colon, and 12 hours in the last part of the colon. Now, certainly people go faster than that, and even every individual has had faster bowel movements or slower bowel movements, but that's about an average. The way that we generate a bowel movement is through the coordination of different muscles and nerves. And the way that it starts is by using the diaphragm muscle to induce an increased intra-abdominal pressure in the abdomen compartment. And we also use our anterior abdominal wall to squeeze to also make the abdomen a smaller place. And that tends to push stuff out. And then we also have to relax certain muscles in order for the stool to come out. And there's 2 main muscles that we relax. One is a big muscle, a striated muscle called the puborectalis. And when that relaxes, the rectum could open up and poop could come on out. And then it requires that the anal sphincter also relaxes in order to get out. And that's sort of the last step in the process. One of the frequent problems that I experience, independent of slow transit, independent of hard stool and unpleasant rock type stool, is a feeling that it can't come out. And one of the reasons for that is pelvic floor dysnergia. And that's where instead of relaxing the anus to let stool out, someone actually squeezes the anus and they don't know it because they're pushing so hard. And in the bottom of this video, in the notes section, I'll have a video link that kind of explains how that could work. And there's a really simple treatment for that, which is basically a very simple physical therapy called biofeedback. So that is how stool movements occur. Is there's stool in the colon that it takes about a day or two to get down there, and then we work these muscles to get it out. And in some people, there is dysfunction of not only infrequent bowel movements, but they also have hard bowel movements, and they also have difficulty evacuating. Maybe because they've had the problem for so long, and these problems have compounded on each other. And that happens more than 50% of the time when there's 2 or 3 reasons for constipation. It's also really important to take a step back and think, why is this constipation occurring in the first place? Is there something that I did to myself? For example, perhaps you're on a medicine that's messing you up. Examples of which were an antibiotic that changed your natural flora, or a blood pressure medicine that slows down the bowels, examples of which are calcium channel blockers. Sometimes mood-altering medicines such as antidepressants, antipsychotics, they slow down the gut. If you're on chronic pain medicines like opiates, that's notorious for slowing down the gut. Sometimes it's your diet and there's insufficient dietary fiber intake, or perhaps too much processed food. And lastly, some people believe that insufficient water to kind of lubricate the stool is one of the factors responsible for constipation. In my personal experience, this is less so, but it's certainly a possibility. Lastly, some people are just really inactive and sedentary, and their bowels don't tend to work as well as people who are on the move and doing a lot of things. So if you're not exercising, that's probably something that would help you if you haven't tried that yet. There are also a lot of natural foods that could help you go more readily, examples of which are coffee or the green juices. Those tend to have a laxative type effect. A laxative is anything that helps you go to the bathroom. There's no stigma in having a laxative. It just means something that helps you go poop. So I want to also just have a couple of disclaimers about this video. Number one is that I tend to use brand names, I tend to use generic names, and I use them interchangeably. I don't think too much about it. It's just whatever first comes to my mind and I say it. So I have no particular preference for brand versus generic. The other thing I want to say about that is we have no conflict of interest here. There's no secondary gain being giving these recommendations. I stand to make no financial benefit from this. I don't prefer one product over the other for any kind of secondary gain. This is just my thoughts on the subject. The last thing is that this video is not medical advice for you. Although I'm a doctor, I am not your doctor, and I don't know your particular situation, but your doctor or your allied health professional does. And I would advise you, if you're interested, is to talk to that person. Nurse practitioners, physician assistant, doctors, chiropractors, they're all skilled in the evaluation and treatment of this common condition. So please use your good judgment. These are just my own independent thoughts and not my medical advice to you. I think this video will take around 20 to 25 minutes. I tend to organize it into 2 main categories. First is over-the-counter products. Second is prescription products. the reason I did that is because it just helps one organize their thoughts, like what things do I need a doctor for and what things do I not need a doctor for. And it doesn't mean that the prescription is in any way better than the over-the-counter, or vice versa, that over-the-counter is safer and better for you than the prescription. We also make special notes about whether something is like a drug type of therapy versus a more natural or supplement type therapy. In this video, we integrate concepts of Western medicine as well as Eastern medicine. We integrate the two to find whatever is the best. So with that said, let's first talk about one of our first solutions for constipation, which is adequate fiber intake. In general, we shoot for around 25 to 35 grams of fiber in our diet, and whether that is achieved through the dietary intake of fiber or through supplements, which I'm going to show you, whatever it takes to get around that much is probably a good goal. One thing about fiber is it tends to be bloaty because it could ferment in your body, and the side effect of that is distension, discomfort, flatulence. So not everyone does well with fiber. Please use it at your own caution. Another concept of fiber is it's good to take with a lot of water because it just needs it to do its thing. The second thing is you don't want to go all in on fiber. You want to gradually build your way up. An example of which is 1 serving of fiber daily for 1 week, then 2 servings of supplemental fiber per day for 1 week, then 3 servings per day for 1 week. And that way you don't tend to get overhit by gas or burps or farts. And that's a good way to integrate it. And then in general, my personal approach is if you get it through diet, it's better than getting it through any supplement or product. But with that said, there's a lot of safe ones. The first one I want to talk about is metamucil fiber, also known as psyllium fiber. This one is very popular in America, and it comes in wafers, pills, or it comes as that powder that I just showed you there. There's also fiber cereals, examples of which are Fiber One cereal or All Bran cereal. Those pack a really hefty punch, and I like that one for if you want to do a dietary version. I happen to think that like a cereal like All Bran or Fiber One with lactose-free milk and some berries is a good dietary way to introduce fiber into your life. Another fiber is called benefiber, which is a wheat dextran fiber. There's also ones called Citracel and Consul, and you could experiment with the different ones. If you're not a fan of fiber or it didn't work for you, a stool softener is another choice. And a stool softener also requires water. An example of one is called docusate sodium, and the approximate dose is about 100 milligrams, and it's taken as 1 pill daily, sometimes 2 pills daily. Very safe, not habit forming in any way, and sometimes it works, sometimes it doesn't. One of my favorite products for hard stools and infrequent stools is Miralax, which is polyethylene glycol. And that is basically this powder that you would put into this cap, which has a white cap on the inside, a white fill line. And that's 1 heaping tablespoon. You put it into a glass of water, and then you stir it and drink it. It's tasteless and odorless. If you don't want to carry around the bottle, you could also do these individual packs, which is great for travelers. In general, another common cause of constipation is change in environment, like traveling. It's really common for people to become constipated, particularly with changes in barometric pressure in the airplane. Another kind of class of laxatives is something called stimulant laxatives, and these include magnesium, Dulcolax, Senna. And a very popular magnesium one that we use is magnesium oxide, 500 milligram tablets. And we advise 1 to 2 tablets per day. It's a very low dose, and it tends to keep people regular. It doesn't tend to cause cramping. In general, the stimulant laxatives cause contractions like this. And when that happens, sometimes they're very strong and it could hurt and it could cause abdominal pain. Most people don't get that, but if you do, it just means that this medicine didn't agree with you. It's not dangerous, but listen to your body if you're getting those kind of symptoms and it's not working. Philips magnesium oxide isn't very strong, but something that is stronger is called milk of magnesia. And this is a liquid, and you could take 30 to 60 milliliters 1 or 2 times a day, and that helps you really go. That tends to work more reliably and quicker to help you evacuate on a bad day. It's not meant for everyday use, in my opinion. Another thing that we do when people are really having trouble and they need to get it out that day, they're calling our office and they're saying, I'm really backed up, I'm in terrible discomfort. What can I do now that's over the counter to get it out? We say to our patients magnesium citrate, and that's 300 cc's or 300 milliliters of this liquid solution. And in general, it tends to work that same day. It's pretty strong, sometimes the next day, but it could really make you go. So you don't really want to leave the house after you take something like that. And it's highly reliable. Caution about magnesium products. If you have kidney disease, especially kidney insufficiency, it's probably not the right choice for you, and you should definitely talk to your doctor about that. Another popular stimulant laxative is something called Senna or sinusoids, and these are pills that you could take, and these pills tend to work softly and nicely to help you go. They're marketed as products such as X-Lax. Chinese teas have a lot of Senna in it often, and Swiss Chris or Smooth Move are examples of products that have Senna in it. I really like this product, but one of the main downsides that limits its use in our office is that it tends to be habit forming. And what that means is you don't become addicted to it, but you need higher and higher doses over time in order to have the same effect. Another unfortunate downside is it tends to stain and discolor the colon lining cells, causing a condition called melanosis coli, which is basically darkening of the lining. It's unclear whether that's dangerous or harmful, but it just doesn't look right at the time when we do a colonoscopy. And in general, we try not to have people take medicines where they need higher and higher doses over time. So it's great for that quick use for when you're in a bind, but it's not something people would stay on for a long time. Another product that's a stimulant laxative is called Bisacodil, also marketed as Dulcolax. And these are 5 milligram tablets, and these too cause contractions of the colon to help you go and defecate. Tends to be a little bit more uncomfortable than Senna, but not always. In some people, it doesn't cause any problems. And this could be a nice adjunct when you just need to get it out. You're already on one thing, but you need a little booster that day. Dulcolax Bisacodil is good. If it doesn't work for you in pill form, there's a medicated suppository, which is basically a piece of like wax that has medicine in it, and you put it in your backside, and it stimulates a bowel movement through a local irritant effect. Very safe. Probably not something you would do every day, but can be done every day. And that's one option. Other things that you could put in your backside to help stimulate a bowel movement would be called an enema. An example of one is called Fleet's Saline Enema, which is basically a squeezy bottle that you put into your backside. You squeeze the bottle. It's got a lubricated rubber tip. The fluid comes out, goes into your rectum. You kind of hold it there for a few minutes. Then you get up and you go and evacuate that in the toilet. And that's great when you have just like a lot of stool and perhaps it's getting almost impactful and you want to soften it up and get things going on a local level. Those are enemas. There's lots of different kinds of enemas too. There's something called a soap suds enema. There's different kinds of suppositories called glycerin suppositories, for example. Yeah. Sometimes people who have constipation also have a lot of discomfort in the anal area from going, whether it's due to hemorrhoids or whether it's due to a cut or an abrasion called an anal fissure, meaning sometimes just having constipated or hard stool causes you to push, strain, and cut the lining. That hurts really bad when that happens. Sometimes it could even bleed. And once you have a fissure or a cut, it's kind of harder to heal. One of the strategies we have for people who have constipation and cuts and abrasions is we use mineral oil in the form of a medicine called Chondromel, which is basically a combination of mineral oil and Irish moss fiber. And that can be taken daily. It tastes really good. It tastes like marshmallows, and it helps make your hard stools easier to pass. It's really popular for people who just need some help making it softer and getting it out. If you also have diaper rash around the anus from all of this business, you could use a cream like Desitin cream, which is 40% zinc oxide. It's against diaper rash. It's what you would give a baby. Another thing you could do down there would be Balneol, which is another safe, soft cream-like thing. For people that don't like Western medicines and they want something more natural, there are these other kind of products, which I refer to as supplements or Ayurvedic medicines. A popular one that we use is called Triphala 500 milligram pills. And these have what feels to me like a stimulant effect to go. It tends to work quite reliably. And this is something you might consider if you're not into Western medicines and you want something more natural. Basically, I think all of these supplements in general are less well investigated than prescription drugs or well-established traditional Western drugs. But that doesn't mean that it's safer or more dangerous. It's very confusing with supplements because we don't have that kind of data that we've accumulated over years through FDA regulatory surveillance. Another popular new over-the-counter supplement that we like for bloating is called Atrantil. And this is a combination of peppermint and a couple of other substances, and it helps for bloating. I would say that it's not the best treatment for constipation, although sometimes it can be, but it's nice for the bloating component. And stay tuned for further videos where I talk about bloating and things that could be done for that. So we've now covered some food issues related to constipation. We've discussed some over-the-counter Western style supplements. We've talked about some Eastern style or Ayurvedic supplements. And then I want to now talk about prescription medicines, which could be better, the same, or perhaps less effective than what we just talked about. One of the first ones that we'll talk about is called Linzess, also known as linaclotide, and it comes in 3 doses, low dose 72, moderate 145, and high dose 290. We never know which one is going to work the best, so we tend to start off at 145, and if it didn't have the desired effect, we move up to 290, and if it worked too well, then we drop down to 72, or we alternate every other day. We find that right balance that helps you have a successful daily spontaneous bowel movement with the right consistency. On that note, one of the knocks against Linzess, in my opinion, is that it tends to have like more liquidy type of bowel movements as opposed to like a formed spontaneous bowel movement. Other ones in that same similar family would be something like Trulance, which also is a once daily pill. And with this one, it tends to work to bring water into the gut. Trulance tends to work well on small intestine, water infusion, and Linzess tends to work more on colonic ones, but they both have the same effect, basically generate a spontaneous bowel movement. Spontaneous doesn't mean you're going to have an accident in your pants. It just means it brings water into the colon, helps lubricate stools, and off you go to the bathroom with time and warning. Another class of medicines that treats chronic constipation, but that doesn't tend to make as liquidy a bowel movement in my personal experience, are the prokinetics. examples of which are erythromycin, low-dose naltrexone, and prucalopride. Prucalopride is the most recent one to the market. In America, it's marketed as something called Motegrity. And in Canada, it's marketed as Resolor, but it's basically the same medicine. Some people prefer to get it from Canada. Some people prefer to get it from American pharmacies. A medicine that was prescription many years ago, it was called Zelnorm. It was also known as Tegaserod, which is the generic name. It was taken off the market and it was brought back because it used to do such a good job. It's brought back and approved for the treatment of these kind of symptoms in women only in America. Sometimes we're in a real bind and people cannot go and they are just toxic from this situation. They can't work, they have to stay home, they have a lot of pain and discomfort. It's really affecting their quality of life and they need to that day go or else. In those situations, we rarely use a full dose colonoscopy prep off-label. It's not how it's supposed to be used, but it's enough to generate a complete evacuation if we suspect there's no obstruction. Examples of which would be Go Lightly, which is a big jug of 4 liters of polyethylene glycol. There's lower dose versions of that called Movie Prep. The prep that we often use for colonoscopy in our office is called Suprep, and it's smaller volume, but it carries a really big punch. And it's 1 bottle mixed with 2 big glasses of water in the evening before colonoscopy, and 1 bottle mixed with 2 big glasses of water on the morning of the colonoscopy. And that's usually enough to really empty you out. Sort of like our last resort option when we really gotta get people unplugged. There's a lot of other different colonoscopy preps, including Plenview, and there's others. There's just a lot. And there's probably newer and better ones coming out on the market in terms of taste and tolerance. So these are my basic ideas about chronic constipation. I've shared with you around 25 different therapies, which I'll have described below. I'd love to hear your thoughts on this subject, and especially if there's other videos that you'd like me to create. Again, this is not medical advice for you. This is more just my reflections and experience having treated people for over 14 years with this problem. I encourage you to visit our website if you have any other interest in these kind of things, which is www.treyzonmed.com. Thank you.